husband was a neurologist, and she said, I give up on medicine. I don't know what else to do. So she said, I don't know where to go. And so a pharmacist sent her here, and so we worked on her, and she got amazing results. So anyway, if you're just joining us, welcome. I'm going to talk for 24 minutes. Just got our other camera up. I'm going to talk for 24 minutes, answer questions at the end of 24 minutes. So type in your questions on your platform. Then I'll do another 24 minutes, and then we'll do questions again. So, John, I'm ready to go whenever you are. We just got to get our little clock. There's a big clock behind me. So ready? Hey, folks, Dr. Joe Esposito here. Glad you're with me today. We're going to talk today about memory loss and what causes it. Because so many patients come to me, and the big issue is that they're having memory loss, or certainly their parents are having memory loss. And it scares me because, I'm in my early to mid 60s, and I have people come in all the time and say, my mother, oh gosh, she's losing her memories, but she's 70. So that's acceptable? That's not acceptable. So we've got to work real hard to get the body as healthy as we can. I want to talk about what can cause it and then the things you can do to prevent it. Because I was talking to somebody the other day, and she was saying that her mother remembered her, but doesn't remember why she remembered her, and doesn't remember any of the grandkids, this lady's kids. And she doesn't remember any of them, but she says, I know you from somewhere, but I don't know why or where. That must break your heart. I remember years ago I dated a gal, and her mother was in assisted living, and the same thing. And it's almost like they're joking. It's like, what do you mean you don't remember me, Mom? I'm 35 years old. I talk to you every day of my life for 35 years or 40 years or whatever it is, and they just don't remember. And it's so weird because they're very sincere. They really don't remember you. So let's talk about the things that can affect our memory and what we can do about it. One of the common ones is medication. And this is something a lot of people don't talk about, because if you're taking even over-the-counter medication or prescription, it may cause memory issues. Now, antidepressants, antihistamines, anti-anxiety medications, muscle relaxers, tranquilizers, sleeping pills, pain medication given after surgery. Many of these medications that we think are benign, I'm just going to, I have pain, I'm going to take my pain pills and I'm good. And every day in my practice, patients come in, and I always say, what drugs are you on? And they'll say high blood pressure. High blood pressure is number one. Cholesterol and diabetes is kind of tied for number two. But a lot of people have taken long-term pain medications, antidepressants. And I don't want to be pompous with my patients, but I always ask the same question. Has anyone ever discussed with you what to do to get rid of the pain, to get to the cause of the pain, to get rid of the depression? And 100% of the time, for 40 years, the answer is no. I'm diagnosed with anxiety, ADD, ADHD, depression, and so I'm on these medications. Well, the medication going to fix anything? And again, I don't want to be a jerk when I ask these questions, but the answer is always no. When do you come off high blood pressure medication? If I have an infection, I take antibiotics, I come off them. When do you come off high blood pressure medication? When do you come off antidepressants? When do you come off your pain medications? Many times the answer is never. And so I'm not saying don't take your medication. Please understand that. If you need medication, absolutely take it. But let's try to get to the cause of the pain. Let's try to get to the cause of the depression. Now, sometimes it's a clinical issue. I understand that. There's not much we can do about that. Maybe genetics, maybe a clinical issue. But there's a lot of things we can do. For pain, for example, chiropractic care, most effective, least expensive treatment for pain. Has anyone ever told you that before? Probably not. So if you have neck pain, back pain, shoulder pain, numbness, tingling, sciatica, go to a chiropractor first. I had a chiropractor come to me this week. Good friend of mine, Nelson. And he came in and he said, Doc, man, my hip is killing me. I need your expert evaluation, man. I can't figure it out. Took an x-ray. He's got a lot of arthritis. We did something called acoustic wave therapy on him. We did some cold laser on him. We put the hip back in place. And he stood up. He goes, that's about 50% better. How about that? So chiropractic care, most effective, least expensive treatment for pain. So get to the cause of the pain if you can. Sometimes you can't. I have a friend of mine out in California, Johnny, and he's got this very rare blood tumor. Blood has leaked into his spinal cord, and he's on medication. Now, he's all holistic, and he's all natural, and he's vegan, and he eats right, and he takes supplements. But there are certain times where you need the medication, and that's the case for him. But if we can avoid these medications, I want you to do that. Anxiety, depression, how many people have it? I've done shows on this before. Many times, there's a digestive component that's never been discussed when it comes to anxiety and depression. So, for example, your stomach, if it's not digesting food properly, you're not breaking proteins down into something called amino acids. There's 20 amino acids in a human diet. The amino acid named tryptophan becomes serotonin, combines with vitamin B6, creates serotonin, and serotonin then travels up to the brain and helps keep you focused and happy. So if you have acid reflux, heartburn, burping, gas, bloating, diarrhea, constipation, that can be contributing, not necessarily causing, but contributing to your anxiety and your depression. Why not fix that? And usually it's very easy to fix. Digestive issues are usually pretty easy to fix when you know how. So medications can be causing memory loss. If you're just tuning in, I'm talking about memory loss and things that can cause it. Medications is oftentimes a biggie. So why don't we try to get to the cause and reduce the need for medication? That's my goal. I'm not going to tell you to stop taking drugs. I'm going to try to get you well enough so you don't need the drugs. And then talk to your doctor. Hey, listen, doc, my blood pressure's doing better since I've been taking nitric oxide and getting my digestive system fixed, which is taking the stress off my sympathetic, off my vagus nerve, which also affects the heart. Can I do something about that? Maybe we can reduce the medication. I'll tell you a story. Last week, I went out to dinner with my friend Tim, and we went to this Ethiopian restaurant, and I love Ethiopian food. And we had Ethiopian food, and Tim was still a little hungry. So he said, let's get one more side dish, and we got the side dish of lentils. And it was so good, I kept eating it. And I was so full. I mean, painfully full. I know better, but I didn't listen. So driving home, I started getting heart palpitations. And I got home and I'm sitting down and my heart was just going crazy. Rapid heart rate, skipping beats. It was just nuts. Why was that? Well, the vagus nerve is a nerve that controls my stomach, but also has some control over my heart. So that much volume put pressure on my vagus nerve and it caused me to have this irregular heartbeat. So I took some digestive enzymes and I sat for about 2 or 3 hours and the food finally got digested and moved on. Heart rate went back to normal. But I knew what the problem was. I caused it myself. So many times, rapid heart rate, high blood pressure, we always have to look at what else is there. Maybe it's a sodium-potassium imbalance. Maybe it's a kidney issue. Maybe it's a digestive issue. Maybe you just eat too much. That's what we always have to look at. Instead of saying, yeah, I have high blood pressure, what am I going to do about it? I have AFib, what am I going to do about it? Nothing. I'll take the meds. So I'm not against the meds. But just know that there's other options up there. Other things that can cause memory loss. Of course, alcohol, tobacco, drug use. Certainly these are all linked to memory loss. And, you know, of course, we probably all know somebody who drinks way too much. And when they drink way too much, you can't not suffer the side effects of drinking too much. I'm fine. I can drive. I'm good. I don't get hangovers. I get that. But there's still chemical damage that's occurring to the liver, the brain, the kidneys, the blood vessels, sexual function. And so, yeah, you're not going to get away unscathed if you drink a lot. Okay, so just understand that. If you do drink, and I wish you wouldn't, but if you do drink, I want you to try to mitigate the damage that the alcohol has done. And one thing you can do is take some extra supplements. So I recommend everybody take Dr. Joe's Super Greens, Dr. Joe's Essential Source, B Complex, and Vitamin D. That's the minimum supplements I'd recommend every day. And those are on my website, drjoe.com. But if you're going to go drinking, I want a second dose of Super Greens, Essential Source, and B Complex. Try to mitigate some of the damage from the alcohol. I don't drink. I don't like the way I feel when I drink, so I just don't drink. But if you do, stop causing so much damage because alcohol destroys brain cells. And your brain controls what? Everything. A little bit of alcohol, a little bit of damage to the brain. A lot of alcohol, a lot of damage to the brain and the liver and the kidneys. So please, if you're going to drink, at least mitigate that damage. That's really important to do. And drink a lot of water because alcohol flushes out fluid, right? You notice you drink 1 beer, you pee out 3. Where'd those other 2 beers come from? Your body has to flush out that alcohol to get it out so it doesn't affect the brain. And so there's a lot of things we can do to protect ourselves. So I wish you didn't, but if you do, like I said, I'm always going to negotiate with you. When it comes to meat, for example, if you eat too much meat, saturated fat, and there's a whole argument over that. But if you're going to eat meat, at least do organic. If you're going to do eggs and dairy products, at least do organic. Again, try to make the better choice. And that's what it's all about. What's the best choice I can make for my health in this situation at this moment in time? If it's pain, maybe it's chiropractic. If it's alcohol, maybe I should take some supplements with it. If it's a digestive issue, maybe we can come see us and we can physically pull the stomach down away from the diaphragm. There's a physical move we can do for people with acid reflux, and it's amazing the results. I was telling a story. I had a patient come in last week, and she has a master's in nursing, and her ex-husband was there. He was a neurologist, and they referred to me by a pharmacist. And I said, how'd you find out about us? Pharmacist told me about you because she goes, I'm sick and tired. I've been to hospitals. She had explosive diarrhea. She was white as a ghost. Her kidneys were in failure. And she's a young girl. I mean, she was my age. She was young, but she looked great. She was in great shape. She's a yoga instructor. And she said, I don't know what else to do. She goes, they keep saying, well, there's nothing we can do for you. So I went through my whole thing with the muscle testing and fixing the stomach and adjusting the nerve to the kidneys. And we worked on several different things, pumped fluid up into her brain, cerebrospinal fluid up to her brain. And she stood up and she had color back in her face. She was white as a ghost when she came in. And she had color back in her face. And she just looked at me. She says, I feel better. And she said the question everybody asked, why didn't somebody tell me about this sooner? And then her ex-husband, who's a neurologist, said, listen, I got one case especially I want to send to you, irretractable headaches. And we've done every medication. We've done Botox. Nothing is working. Would you be willing to take this case? I said, I'd love to co-manage your case with you. So what we do is different than everybody else. So just because somebody says it can't be fixed, it just means maybe they can't fix it. Sometimes it can't be fixed. I understand that. But many times there's alternatives. And that's what I offer to my patients. So if you ever want to make an appointment to come see us, aside from getting all this knowledge, if you ever want to make an appointment to come see us, we have offices in the Atlanta area, Marietta, Duluth, and Stockbridge. Just go to my website, drjoe.com, drjoe.com. I'd love to be your doctor. Let's take a look at the nervous system. Let's take a look at the digestive system. Let's do a dietary workup on you. Let's see if you're deficient in anything. Most people are deficient in something. I've done tests on myself. For example, I started going gray a couple of years ago. And I figure I'm of age, it's okay. And I did a hair analysis. I found out I was low in selenium. Started taking selenium, my gray hair went away. Now, that's not saying you're gray because of selenium deficiency. We have to do a test. Did the analysis, took the selenium, problem was solved. Most people are low in zinc. You know, you can buy a zinc supplement. I'd love to sell you a zinc supplement, but have a couple of handfuls of pumpkin seeds every day. Get some organic pumpkin seeds and have 2 or 3 handfuls every day. They help kill parasites in your colon, and they're high in zinc. And so zinc is very important for everything from sperm production to immunity. And something as simple as pumpkin seeds can solve that problem. So we always try to give you information that you could use every single day. And we're talking today about memory loss, and we're all afraid of that, I think. I am. And people with traumatic brain injury, we're going to talk about that in a second. Head injuries can lead to it long term, years and years later. And I have a traumatic brain injury. I was hit by a car when I was 10. I was in a coma for several days. So, yeah, I've got predisposition to memory loss. I don't think it's a lot of fun. If you smoke, it's going to harm your memory, of course. Studies have shown people that smoke find it more difficult to remember faces and names. Illegal drugs can change chemicals in your brain as well. I had somebody that worked with me years ago, and he started vaping when vaping first came out. Vaping's safe, vaping's fine, there's no problem at all. I said, I don't think so. It was new to the market, and the research wasn't out yet. I said, but it just doesn't make logical sense that vaping is okay. And sure enough, now we know that it can cause damage to the lungs, permanent damage, just as bad as cigarettes, for different reasons. Well, just because it didn't cause the same problem cigarettes did, it's causing other problems. So please, folks, don't vape. I understand it can be addictive. I understand cigarettes can be addictive. I was out for a walk the other day with a buddy of mine, and we walked past a senior housing group. And there was no name on the building at all. It just said, resident parking only, blah, blah. And sure enough, there's a bunch of old people outside smoking. He goes, it's probably senior citizen home. They won't let them smoke inside. And I said, yeah, that's probably right. And then we looked, and sure enough, it was. So I get the addiction. I understand it. I've done a show on addiction. If you go to my website, drjoe.com, just type addiction in the search bar, you get the information on that. So, but what we do in our office, we do the testing. We check the nervous system. We check the digestive system. We're always trying to figure out why. What can we do better? And you may not want to do everything I say, but at least do something. So again, make an appointment to come see us. Neck pain, back pain, shoulder pain, car accidents, drjoe.com, drjoe.com. You can book an appointment. Normally, the first visit is $940. I've reduced that for you, my listeners, to $299. That's an exam, x-rays, consultation, first treatment, going over the x-rays, and a complete nutrition evaluation. Why do I charge so little? We do that because I want to find out what the cause is. And is it a chiropractic case? Is it a nutrition case? Orthopedist, neurologist, neurosurgeon, gastroenterologist, neurologist? I don't know. Let's find that out, and that's why we offer it to you, so we can say what's going to be the best thing. So drjoe.com. We accept most insurances, car accidents, sports injuries, Medicare. We're on the VA referral list. We got a good reputation, and I want to keep it that way. I want to get to the cause of your healthcare problems and not just treat the symptoms. I'm okay treating the symptoms. but I want to get to the cause as well. So if you're just tuning in, I'm Dr. Joe Esposito. We're talking today about memory loss and what causes it. Sleep deprivation is a biggie too. Now, all of us have some nights we just can't sleep. I get that. But we always want to try to get to the cause of that as well. And sometimes sleep issues can be due to digestive issues. If you listened a few minutes ago, we said the stomach breaks proteins into amino acids. And amino acid tryptophan becomes serotonin in your brain. Serotonin calms you down, makes you happy, and helps you focus. But serotonin converts into melatonin. Melatonin does what? Helps you sleep. So if you don't have the proper serotonin, you don't have the proper melatonin. So not only can you not, you may not be focusing and have ADD or anxiety and depression, which can lead to memory loss. You then parlay that into sleep issues, which can also affect the memory. So we want to get to the cause of the problem, not just treat the symptom. Pain. Many times pain is the reason people can't sleep. And so that's why now, as an expert in pain management, we always try to get to the cause of the pain as well. Because if you're in pain and take drugs, then you got two things causing memory loss, maybe causing memory loss, pain and causing lack of sleep, and then the drugs as well. So why not do it all? I used to date a girl years ago, and she had a phrase. She said, moderation is for monks. And I said, yeah, moderation is for monks. I don't want moderate health. I want extreme health. In fact, the second book I ever wrote is called Prescription for Extreme Health. I want extreme health. And you can't get extreme health unless you get the nervous system, digestive system, and your diet straightened out. You can't. I don't care what you do. You can meditate. You can work out. You've got to get the core things working. You got to tune up the body and then add these other things to it. Absolutely work out. Absolutely meditate. But you got to tune up the car first before you put the good gas in it. And that's why I want to be your doctor. And that's the approach we take. So depression can certainly lead to it. We talked about the digestive issues. Now, sometimes there's depression that you have to understand can be healthy. I had a friend of mine, his father passed away the other day. And I was talking to his wife. And she said, I don't know if he's processing it yet. He just got the news and he was out running around and doing things. And I understand that. That's a normal reaction. You go into shock. I did when my parents passed. But then you have to go, okay, let me go through these phases of grieving. E. Kubler-Ross wrote a book years ago. In fact, I did a report on it in high school called On Death and Dying. And she said you got to go through your 5 phases of grief. And if you get stuck in one of those phases of grief, it's an issue. What is it? I can remember from back in high school. Denial, anger. No, denial, bargaining. You bargain with God. Oh, God, if you could just make this go away, I'll feel better. Depression. And there's another one in there. And then, of course, acceptance. But we have to go through these phases of grief. And it could be a breakup of a relationship. I've had relationships end where I go into this state of depression. I can't believe this happened. I thought this was going to be a forever plan. So when you understand, am I going through the 5 phases of depression? You could look up the 5 phases and make sure you're going through all of them. And sometimes you might go back and forth a little bit here and there, but you want to keep moving forward. So E. Kubler-Ross was a researcher, and she wrote the book On Death and Dying, but that's where she came up with that. And so it's okay to be depressed. Just understand that no matter what you're feeling, that's going to change. And if it doesn't change, that's when we may need counseling to work through those phases. And it can be shocking. I remember when my parents passed, it wasn't planned, and it was a shock. And, sometimes relationships end. It's a shock. Maybe you lose your job. It's a shock. So when you go through this, even minor ones, you got to go through those 5 phases. Sometimes you go through them real quickly. Sometimes it takes a little longer. Sometimes it takes years. I remember my father passed away. My mother said, I don't feel like an Esposito anymore. And I said, I don't know what you mean. She goes, well, I was married to your father almost 50 years. My whole identity was I was Rose Esposito. And now suddenly, I'm not an Esposito anymore. And it took her about a year, and we talked about it a year later, and she said, no, I understood what I was feeling. And it was good she went through that process. She went through the grieving process. So depression and stress certainly can be an issue, and you got to understand what it is and then what proactive steps can you take. I've done shows on each one of these topics, by the way, too. If you go to my website, drjoe.com, just type in what you're looking for, and we've got a show. We've covered it there. So if you're tense, your mind can be overstimulated. There's a thing called relationship bonding styles. And if you're dismissive avoidant is one of them. You probably had a trauma in childhood and your emotional needs weren't met. And so it's going to be a real tough time for you to have emotional connections with people as time goes on, whether it's friends or romantic relationships, because you don't trust anyone. And you're afraid that if you express your emotions, you're going to be hurt like you were when you were a child. And so you become a dismissive avoidant. And so you can avoid relationships, make up excuses. Well, I didn't like that job anyway. I didn't like that girl. I didn't like that guy. You make up excuses. So you have to say, okay, wait, what's wrong with me? Maybe it's the other person, but what's wrong with me and what can I do to get through these things? And so these things can long-term lead to things like memory loss. Something that happened as your childhood can actually lead to memory loss. And that's scary stuff. And so that's why it's so important to take care of yourself. Physically, emotionally, digestive, nutritionally, all that's really important. That's what we do in our offices. I said earlier that head injuries can cause problems. And I said something, I don't know if you caught it. I said I have a traumatic brain injury. Even though I was 10 years old when I got hit by the car, I have a traumatic brain injury. Wouldn't you want to say I had a traumatic brain injury? Traumatic brain injuries always leave lasting effects. So if you're in a car accident, for example, the seatbelt might be holding your body, but nothing holds your head. So your head snaps back and forth. And your brain is floating in fluid inside your brain. So if my head goes forward, okay, let's assume I'm in a front-end collision. I go forward, my brain slams into the back of my skull. And then as my head goes backward, my brain slams into the front of the skull. It's called a contra coup injury. And that can cause traumatic brain injury. So if you're in a car accident, you have anxiety, depression, loss of memory, headaches, loss of sleep, blurred vision. All of this can be signs of traumatic brain injury. And so I actually teach classes, continuing education for doctors, on the nutritional approach to traumatic brain injuries. Doctors from all over the world take my classes to learn what can I do once somebody has a traumatic brain injury. You can't go in and rub it. Your skull's in the way. So what do we do proactively to treat a traumatic brain injury? And a lot of it has to do with nutrition. Magnesium is really important for TBI patients. Cutting out glutamine because the traumatized area releases glutamic acid into the brain, and that can cause pain. Magnesium helps offset the glutamine or glutamic acid, so you want to stay away from monosodium glutamate. So little things like this make a big difference in your health care. And unfortunately, I don't know anywhere else you're going to get all this information. So if you like what you're hearing, please follow me on social media. It's Dr. Joe Esposito. Facebook is the Dr. Joe Esposito. Podcast, you're a podcast junkie? Subscribe to my podcast. It's Dr. Joe for the Health of It. Dr. Joe for the Health of It. So make sure you subscribe to the podcast. We put out at least 2 podcasts a week. And we have all of our shows, podcasts, radio shows, television shows, archived on my website, drjoe.com. And on the top, it says education, and it says radio show, it says podcast. You can go back, and we have archived everything there. Search the website. Just type in what you're looking for. Chances are we've done a show or a podcast on it. And if we don't find what you need, or if you want to save time, just email me. Go through the website, drjoe.com, and it says bot pops up. Say, want to chat, or it says contact us. Either way, it'll come to me directly. I will personally answer your questions for you. I hope I have an answer. I usually do. But I want to help get to the cause of your healthcare problems and not just treat the symptoms. I want to be your doctor. I really do. Whether it's just giving you advice or actually seeing you in person or getting supplements into you, whatever it takes, I want to be the guy to take care of you. So head injuries are tough. Sports injuries, I played football and hockey. I'm sure I got multiple concussions. I remember one time getting hit so hard that I went into the wrong team's huddle. And they turned me around and pushed me back into my huddle. And at the time, you know what we did? Kept playing. Worst thing you can do is multiple traumatic brain injuries. I had a bunch of them. Car accidents, sports injuries, getting hit by a car when I was 10. Multiple traumatic brain injuries cause a lot of problems. So if you've had a traumatic brain injury, and chances are you have, at some point in your life, you bumped your head. It could have been a mild traumatic brain injury. We've got to address that. You can't just ignore the fact that, hey, I had a concussion and it's gone. It's not gone. It's never gone. And if you keep beating your brain up, you will have problems. And one of those side effects could easily be memory loss. And that's what we're talking about today, memory loss. I want to keep your brain going. I take supplements like Super Green Essential Source, nitric oxide to increase circulation, B-complex for my brain. Oh, I see I'm up against break. Folks, I'm Dr. Joe Esposito. Don't go anywhere. We're going to be right back. All right. Got some questions for me on this pop-up show today?
For someone who is slightly overweight and approaching their mid-80s, what can be done to increase their mobility?
Chiropractic care. Chiropractic care, the whole point of chiropractic care is mobility. Mobilize all the joints. In fact, that's pretty much a definition of it. So come see us. We accept Medicare. And let's keep those joints mobile, because that makes a bigger difference than anything. Bigger than physical therapy, bigger than exercise, bigger than nutrition. You got to mobilize those joints physically. And then we add the nutrition and the physical therapy after that if we need to. That's when you see the best results. So, yeah, you want to come see us, and we'll check everything from head to toe. And if anything isn't moving, we'll get it moving for you, we hope. What else?
Is weightlifting and periodic fasting the best defense against diabetes?
Diet is actually the best defense against diabetes. Now, whenever you eat a meal, I've talked about this on the shows before, go for a walk. Because once you just start moving your muscles, even if you just do some squats or some lifting up on your toes, you're going to start driving the sugar from your blood into the muscles. So right after a meal, no matter what the meal is, go for a 10-minute walk, 20-minute walk, whatever you want. That's going to be a biggie. Go to my website, drjoe.com, and just type diabetes in the search bar, and you can listen to a show we did on diabetes. We talk about getting to the cause of the diabetes type 2 and not just treating the symptoms. So, yeah, diet is way more important than weightlifting, but they're all important. But actually, not just contracting your muscles, but moving the body is really important for diabetes. Fiber is important. Cinnamon stabilizes blood sugar. Vinegar stabilizes blood sugar. Gymnema is a supplement. You can stabilize blood sugar. Super Green's an essential source, stabilize blood sugar. So there's a lot of things you can do aside from that. So listen to the show, and then if you have any questions, email me. What else?
Are seedless watermelons okay? Since regular watermelons have seeds, is there some genetic engineering going on?
It's not genetic engineering. They're altering how the things are grown. So I prefer seeded organic. I will eat seeded and I'll eat seeded organic, but I usually don't eat seedless watermelon if I can avoid it at all costs. Now, if I'm at an event or something like that and it's there, I might go ahead and eat it. But yeah, seeded organic is going to be your best choice. Seeded non-organic is your next best choice. And then seedless is your least best choice.
My right shoulder has been hurting. Pain in the shoulder and sometimes my elbow. It feels like my bones are hurting. What are your thoughts?
It's probably out of place. Because if the bones in the neck are out of place, that's the nerve to the shoulder, and then, of course, the nerve to the elbows, too. It comes out of the neck and goes down to the arm. But the shoulder itself can be out of place. We treat shoulders all day, every day. Now, if it's an old injury, you might have scar tissue, we'd use something called acoustic wave therapy. Acoustic wave therapy is a machine that sends really, really fast impulses into the joint, breaks up scar tissue, increases circulation, recruits stem cells into the area. So, yeah, we do acoustic. First, we'd set it in place, adjust it, see if that helps. If it doesn't, or doesn't get it all the way, then we do acoustic wave therapy and cold laser. But got to remember something. Pain is a warning sign. Pain is telling you something's wrong. If you ignore it, it's going to get worse. That's the only promise I can give you. I always say if bones are out of place, they will wear out. There's no way around that. If you have a bone out of place, guaranteed it's going to wear out. So the longer you wait, the more damage is occurring to that shoulder. So just go to drjoe.com, make an appointment, drjoe.com, make an appointment. Let's evaluate it, let's x-ray it, and let's see what we got to do to fix it, if we can. Usually we can. What else?
Can a chiropractor adjust a knee with a torn ACL that has not had surgery to replace the ACL? At 59, would you get surgery to replace or just build new muscles around it?
I would work on the muscles. I'd put the knee back in place, and I'd use acoustic wave therapy and cold laser to try to prevent surgery. Now, can I guarantee I'm going to prevent surgery? No. But heck, it's certainly worth a shot, because we've had countless patients over the years being told they need surgery, and they don't. They don't need surgery after we work on them. Now, I want to keep it at your 59. If I can keep that knee healthy for another 50, 60 years, we're going to be in good shape, you know? And so that would be the goal, is try to do the best we can working with what we have. If you need surgery, you need surgery, but I want to do everything I can to avoid it. So, what else, John?
That is all.
All right, cool. All right, let me sip a little more tea here. Give you another 24 minutes of knowledge here. Ready? Hey, folks, Dr. Joe here. If you stayed with us, welcome. I'm glad you did. If you just joined us, welcome. Always a lot of good information. And today specifically, boy, we got a lot of good information. And if you ever miss a show, by the way, you can always go to my website, drjoe.com. We archive all our podcasts. We archive all our radio shows. It's under education. You can go back. You can search the website. If you have a specific question, search the website. Chances are we've done a show or a podcast or a blog on it. Or you could always send me questions. I'm happy to answer your questions. I probably get 15 to 30 questions a day. drjoe.com, drjoe.com. I'm happy to answer them. I answer them personally. Happy to answer them for you. So wouldn't it be nice to have somebody you can just consult with and say, hey, what do I do about this? I'm that guy. I want to be your guy. So drjoe.com. So if you're just tuning in, We're talking today about memory loss and what causes it. And it's a big issue because I talk to my friends and they talk about their parents, or sometimes because I'm in, my 60s now, and they'll say, I'm losing my memory. I'm forgetting things. Or I'll have people that I talk to and they're forgetting things. I'm like, we just talked about that. Now, every now and then a little, brain slip is fine. It's nothing to worry about. Hey, why'd I come in this room? I forgot my keys. But if you start seeing a pattern develop, you should be scared because memory loss is usually progressive. It's going to continue to get worse. So I want to check the nerve supply up into the brain. I want to check the blood supply up into the brain. I want to check your diet. I want to check your digestive system, make sure you're breaking down proteins into amino acids that produce neurotransmitters in the brain. I want to make sure that you're exposing yourself to stimulus. The brain needs 3 things. It needs oxygen, it needs stimulation, and it needs nutrition. And if that simple sentence would become the battle cry when it comes to seniors, we would have a dramatic improvement in senior issues and memory loss. Now, I don't know where you live. I live in the Atlanta area. Everywhere I turn, they're building memory care centers. What's a memory care center? It's senior housing for people that have lost their memory. And if you've ever been in one, it's very sad. And once they close the door behind you, they ain't coming out. You're in forever. So because there's no proactive steps being taken, I am working with a senior housing group now, and we're trying to put together training classes for the residents on things like this. And it's going to happen. It's just a matter of getting it all together. And it's vital because there's no proactive steps. Once you're in memory care, you're looking at maybe $5,000, $6,000, $7,000, $8,000, $10,000 a month to be kept there until you die. Good money. Wow. They're making lots of money doing this stuff, aren't they? Yeah, they are. I don't want you to be part of that. I want to take that away from your future. I don't want to contribute to the economy in that way. I want you spending $10,000, $15,000 a month out traveling, vacationing, going to restaurants, visiting your kids, visiting your grandkids. Listen to lectures like this. That's how I want you to spend your senior years. Not in a memory home where they're feeding you Jell-O and you're watching TV with 20 other people and it smells like urine. I don't want you doing that. And if you want to do it, it's up to your call, but I don't think you want to either, else you wouldn't be listening to the show. So nutritional deficiencies can also be a big issue. And this is something I wish would be addressed, and it's so stupid easy to fix in most cases. Aggravatingly easy. Sometimes we have torn ligaments, sometimes we have damage to the brain, we have traumatic brain injuries. These are a little more difficult to work with. But nutritional deficiencies are usually so easy to fix, and they're so inexpensive. So you want to make sure you're getting the right amount of food. Okay, sometimes people don't eat enough food, but you want to eat the right amount of food. And if you're going to eat anyway, you might as well eat good food. It's that simple a statement. If you're going to eat anyway, you might as well eat good food. Now, I can decide to have a salad with chickpeas and some apple cider vinegar and extra virgin organic olive oil as a salad, and that'll cost me $3, $4, maybe $5, $6 total, and I'm full for lunch. Or I can go out for a burger and fries, which is probably going to cost me about $15 or $20, and that's going to actually decrease my ability for my brain to work. So I could save money, eat better, lose weight, live longer, have better love life, sleep better, have better health, better immune system, or I can spend a lot of money to get sick. Your call. I know it sounds silly, but it is. So deficiencies in B vitamins can affect brain function. Now, B12 is a type of B vitamin. Now, there's different types of B12. B12 is usually attached to something else. So most B supplements, if you look at them, are what we call cyanocobalamin. Cyano means cyanide. Now, is cyanide good to eat? No. So cyanocobalamin is B12, is what most supplements on the market are today. And you think, well, I'm going to save a lot of money, Dr. Joe. I'm going to buy the really cheap B complex, and it's going to save me a lot of money. Well, depending on a study you read, 60% or more of the people can't convert that cyanocobalamin into something called methylcobalamin. Methylcobalamin is the form of B12 that we need. So we can roll a dice and hope we're one of the minority that can actually utilize this cyanocobalamin, or what if we just took a methylated B12, a B12 that's already in the methyl form, methylcobalamin, and whether we convert it or not, it doesn't matter. It's already in the form we can use. That's what I recommend. If you're going to take a B vitamin, specifically B12, you want to make sure it's methylated B12, methylcobalamin. If you're going to take folic acid, I recommend you don't. I recommend you take folate instead of folic acid. That's another B vitamin. So I take Dr. Joe's B complex every day, and it's a methylated B complex. It's a full spectrum of B vitamins. Each one does a little different thing, and it's already in a methylated form. And I'll tell you a story. One of my coworkers, she has a son, and she doesn't mind me telling this story, and she adopted him at birth, and he was addicted to heroin, meth, drug addict. And so her and her husband adopted him as a baby, and his sister was about 2 years older. And great kids. Love being around them. Smart as heck. So pleasant. I mean, just charming as can be. But he's super hyper. And I have to give him special schooling because he can't sit still, and he's always running around. Really smart. I mean, he's, 8 or 9 years old, and he'll come talk to me. We'll talk about anatomy. He loves anatomy. And I've shown him skeletons, and I've shown him books. I got him a puzzle on anatomy one time. I was at a estate sale, and I saw it, and I got it for him. And brilliant kid. I see so much potential on this kid. He can't sit still. So I said to her, I said, Christy, do you give him B vitamin? She goes, yeah, I give him a B vitamin every day, but it doesn't make any difference. So I gave him a bottle of Dr. Joe's methylated B complex as a present to him because it was important that it came from me. And I said, listen, I want you to do me a favor, Ben. I want you to take this supplement every day. Will you do that for me for 1 month? He said, sure, absolutely, Dr. Joe. And a week later, I was talking to Christy, and I said, how's Ben doing? She goes, oh, my God, I forgot to tell you. I said, what? She goes, he's able to sit through an entire class now. 1 week. He's still all over the place, but he's at least capable of staying in the classroom for an entire class. She goes, it's like a miracle. And I said, yeah, he probably couldn't methylate his B complexes, and so his B vitamins, so we got him on a methylated B vitamin, able to use it, the brain was able to function better. Now, I want to adjust his stomach, because if he's not digesting his food properly, I said, does he have really bad gas and bad breath? She goes, oh, yeah, terrible. I said, he's not breaking down his proteins, most likely, and the proteins become amino acids become neurotransmitters, and neurotransmitters help the brain work. So I said, we got the B vitamins under control, now let's start working on his digestive system. She goes, oh, my God, I would love for you to get rid of that. Fix his digestive system for me. I said, great, let's do it. And so, yeah, there's an issue there, but there's things we can do. Now, am I ever going to make him perfect? Because he did have an issue. He was a drug addict at birth. I don't know if I'll ever make him perfect. But the fact that he can sit through a class, amazing. And so that's why supplements are so important. They're not a luxury. They're a necessity for overall health, but specifically today we're talking about brain function. So why wouldn't you do that? Literally pennies a day. Whole lot cheaper than drugs. Now, I'm not saying don't take the drugs. Absolutely. If you need drugs, take the drugs. Absolutely. But let's get the nervous system more. Let's get the digestive system more. Let's get the diet straightened out. Let's tune up the joints. Keep the joints mobile. Let's get them as healthy as we possibly can for as long as we possibly can. That's our goal. There are a lot of people in assisted living, much younger than me. And I have a traumatic brain injury, so I should be much worse than everybody else, but I take care of myself. I want to share 45, 50 years of research that I've done with you. You don't have to look it up. I'll look it up for you. I'll be your ChatGPT. Because ChatGPT, by the way, can be wrong, just so you know that. So head injuries are a big issue. Now, strokes can be an issue as well. Again, a lot of stories today. I got a call from an old girlfriend of mine, and she said, you remember my niece? I said, yeah. She goes, she had a stroke, and she's 62 years old. And I said, what happened? She goes, she was at work, and she fell backwards and hit her head, and a couple of days later, she couldn't move the right side of her body. So they put her in intensive care, and she was there for several days, and when she called me, they just moved her over to a regular room in the hospital. 62 years old, had a stroke. Now, she goes, do you think the fall had anything to do with it? I said, sure, of course. She fell. She probably traumatized some blood vessels. Maybe the blood vessel burst. That's one type of stroke. And cut off blood supply to the brain. Another type of stroke is a bad diet. And you have plaquing of the arteries. A piece of plaque breaks off and clogs up a blood vessel. And whatever on the other end of that blood vessel isn't getting blood supply, that can be an issue. So she said to me, so what do I do? I said, okay, the brain has this amazing ability. It's called plasticity. And plasticity, it's what it sounds like, plastic. And the plasticity means the brain can rewire itself, kind of remold itself like plastic around the damaged area in some cases. Not all, but some. So she says, I'm at the hospital every day with her. I said, okay, so what I want you to do is I want you to rub the damaged arm, stroke the arms, have her squeeze your hand with the damaged hand. She goes, oh, I didn't want to touch that. I've been working the other side. Let me explain this, a little neurology for you. The right side of the brain controls the left side of the body. Left side of the brain controls the right side of the body. So let's assume she had damage on her right side. The damage to the brain was on the left side. So what we want to do is stimulate and send neurological impulses up to that damaged part of the brain to see if we can get rewiring done. And you do that by working the damaged area. And something as simple as moving her wrist, stroking her arm. That's going to be something. Now, you don't have to do it all day. You can do it for a few minutes every couple of hours, but get some impulses up to that brain. And she said something. She said, how come the doctors at the hospital didn't tell me this? And I said, I don't know. I mean, it's basic physiology. It's neurology, basically. It's how the brain works. It's not hard to do. You're going to be there anyway. Why not just stroke her arm? And so a stroke can be an issue. There's different types of strokes, like I said. But if you have a stroke, it's something you want to consider rehabilitating. There's a supplement I take every day called nitric oxide. Nitric oxide support opens up the blood vessels and increases circulation to your whole body, including your brain. And it's one of my secret doctor tricks. I take it every day because I want good circulation to my brain, my heart, my lungs. Many times for men and women, if there's issues in the bedroom, it's due to lack of circulation and lack of nitric oxide. And so you can take a supplement to help your body produce nitric oxide to get the circulation going to every place it needs to be, including the brain. Now, don't take nitric oxide support if you have low blood pressure. If you do, email me. I'll send you a protocol for that. But normal or high blood pressure, most people do very well with nitric oxide support. And I take it every day. If you have high blood pressure, absolutely. It should be part of your protocol to help bring down that blood pressure, along with your drugs. Don't stop the drugs, but continue with that, and let's see if we can bring that blood pressure down. And in most cases, there's a lot of things we can do for blood pressure. This isn't a show on blood pressure. I don't want to, go into that too much. So, yeah, let's try to get the circulation going to the brain. Whether you had a stroke or not, it helps a lot. I love it. I love using my brain. I was talking with Dr. Kat, one of my doctors today, the other day, and we were talking about how excited we get to see patients. Now, I've been in practice 40 years. She's been in practice 8, 10, whatever it is. She goes, I get such a thrill out of seeing patients. She goes, I'm a homebody. I like being home by myself. I like having my privacy. She says, but I love that input we get from the patients. And it's an exciting job we have because we see such great results in most cases. Not all, but most. And so that's exciting to us. I couldn't imagine working in a senior housing with memory care and never seeing anybody ever get better. Of course, I'd get in there and change everything around if I worked there. But I couldn't imagine not having results. And that's one of the things that drives me every day. People say, why don't you retire? You've been doing this long enough. Quit. Kidding? It's therapy for me too. I love watching people get well. So if you have a health problem, if you have neck pain, back pain, shoulder pain, numbness, tingling, headaches, nutritional concerns, digestive issues, make an appointment to come see us. Stop suffering needlessly. So many of you are suffering and don't know what to do about it. I don't know if I have an answer, but maybe I do. So if you want to make an appointment, drjoe, drjoe.com in the Atlanta area, Marietta, Duluth, and Stockbridge. We can do remote consultations if we need to as well. I know this goes all over the world, but I'd love to be your doctor. So drjoe.com. Normally the first visit is $940. I've reduced that for you, my listeners, to $299. That's an exam, x-rays, consultation, first treatment, going over the x-rays, and a complete nutrition evaluation. Let's find out what's going to be the best course of treatment for you. Maybe it's neurology. Maybe it's chiropractic. Maybe it's physical therapy. Maybe it's psychiatry. Maybe it's nutrition. Maybe you just need some supplements. I don't know. drjoe.com. And we accept most insurances too. So why wouldn't you do this? Stop suffering. Do it right now, drjoe.com. Make your appointment, and you're going to be like so many other patients that say, why didn't I do this sooner? Or, like I was telling a story earlier, of this nurse that came to see me last week. How come nobody told me that I can do this? How come nobody even told me this existed? Now you know. I don't know why somebody hasn't told you, but I've told you. So if you're just tuning in, we're talking today about causes of memory loss. Now, dementia, of course, is what you think about. Right? Dementia is the big one, Alzheimer's. Now, Alzheimer's is just one type of dementia. Dementia is just memory loss, and that's kind of a global term that we use. It just interferes with the ability to function on your daily activities. And so it could be something as simple as I don't remember where I put my keys. It could be something as severe as I don't know who you are. I don't know who I am. And so that's a pretty big issue. Blood vessel disease, drugs, alcohol abuse, brain damage, all this can lead to dementia. Of course, Alzheimer's is one type of it. It's progressive loss of the brain cells and other irregularities in the brain. The diagnosis is important, but what about the treatment? That's the biggie. And so my colleagues, all my doctors I know, whether you're orthopedist, neurologist, neurosurgeon, brilliant diagnosticians, but many times they get stumped on what to do about it. What's the treatment protocol? So that's why my office, we co-manage so many cases with other doctors. I'm not saying stop going to your cardiologist. I send him out to cardiologists all the time. I'll take an x-ray. I'll see some clogged arteries. Like, you got to go get this checked. Now. Well, I got an appointment in 6 months. No. Now, today. In my career, I've had 3 patients that I called an ambulance on and said, you need to go to the hospital right now. They have what's called a dissecting aortic aneurysm. I could see it on the x-ray. And they were having abdominal pain, and the aorta was all clogged up, and it was engorged. And all 3 of those cases, the doctor called me the next week and said, you saved their life. We would have never thought to test for this because they had no symptoms. But if the aorta, big blood vessel bursts, you're dead. Game's over. There's no it's not like heart attack. We can resuscitate you sometimes. No, you're dead. And so I'm excited about that. But I wish the whole world thought like I think. We'd have a whole lot healthier world out there. So we're talking today about what causes memory loss. And dementia is a biggie, and dementia is the one we think about, but what do we do about it? Other memory things could be overactive thyroid gland, illegal drug use, of course, infections, HIV can do it, tuberculosis. There's something called tertiary syphilis. Syphilis is easily treated. If you have syphilis, you get a shot of antibiotics and you're done. But if it goes to primary, secondary, and tertiary, if it goes into tertiary syphilis, that's severe brain damage and usually deadly. So, when it comes to being active out there in a romantic field, please be careful. There's a lot of things that can be treated. Some things can't, of course. So getting to the cause of the memory loss is most important. And if you come see us, we can check everything. We'll check your nervous system, digestive system, diet. I have neurologists I work with. I can refer you out to a neurologist. They can do CAT scans. They can do they can do MRIs. So there's a lot of other tests we can do along with, doing the diagnostics. But we can even do neuropsychological testing. You may have a mental block. Something traumatic happened to you as a child or as an adult, and you don't want to remember anything. Your brain is protecting you by shutting it down. So we can do a neuropsych evaluation to determine if there's something like that involved. Maybe you were beaten as a child. Maybe you saw something horrible as a child, horrific as a child, something horrifically happened to you as a child. All this can parlay into your adult life. And you think, well, I'm tough. I don't need counseling. I'm a guy, or I'm from New Jersey, and we don't do stuff like that. It's okay. There's nothing wrong with saying, hey, I need help. And I think counseling is amazing. And with a good counselor, a lot of things can come out. Now, there's bad counselors too. They don't really dig anything. I've had people go to counseling, and basically the counselor was just telling them everything they wanted to hear because they wanted to make money. Counseling sessions sometimes can be tough. They're going to be tough with you, and that's okay. You have to face your reality and then sometimes bring yourself out of that. So memory loss, that's what we're talking about today, may be reversible with treatment. Now, that's a profound statement because not a lot of people think about that. If I'm starting to get dementia, it's just going to get worse and worse and worse. Maybe it's reversible. Not only stop it, but reverse it. Get the nervous system working. Get the diet worked out. There are medications you can take. Sometimes we work with the doctors and we take medication with the chiropractic care, with the nutrition, with the dietary work, with the digestive work. And we work together with the doctors, and that's called co-management. So if you have a stroke, we talked about some therapies that need to be done. There's even a branch of chiropractic called functional neurology. And I've been treated by functional neurologists in the past too. So that's another branch that you don't even know exists, on resetting the brain using eye movements and using body movements and head turning. And so there's so much out there that you don't know exists that I want to let you know exists. And the reason I'm so passionate about this, I'm a patient too. I got issues. And so I want to get the best treatment possible for me. And with that, I want to share that knowledge with you. Had a patient the other day come in. She did not want to do a mammogram. She refused to do it, which I'm not really arguing with her on that. But there's something called thermography. You know what thermography is? It's heat measuring of the body. And you can measure things. There's companies out there that can do full body scans to check for everything. And you can sometimes find cancer the size of a pinhead with some of these testings, with these CT, CAT scan testings. So there's a lot of things you can do to be proactive with your health, not just for you, but for your friends and your family. I don't want to be a burden. I don't have any family anymore. I have one member of my family left, and that's it. So I don't want to be a burden to that member of my family. I don't want to be a burden to society. I don't want to be a burden to my bank account. I want to have fun, man. I see people, like I said, my age, and they're a mess. And it's like, man, I just keep getting better. I don't want to get worse. I want to get better. And every day I'm thinking, what can I do to make myself better? And that's how I want you to think too, if your goal is to get well and stay well. Now, of course, sometimes age comes in. There's heart disease, there's air pollution, there's diabetes. Did a whole show. Go to my website, listen to the show on diabetes. If you lose hearing. My father was deaf, and luckily his brain did very well right to the end. But if you lose hearing, sometimes you start to lose memory because your brain needs what? Oxygen, stimulation, and nutrition. So if you have hearing loss, that can be a problem. How about loss of smell? That can be an issue too. Sometimes loss of smell is something as simple as a zinc deficiency. And what did we talk about earlier? We talked about pumpkin seeds being a great source of zinc. Have 2-3 handfuls of pumpkin seeds every day as your source of zinc. So if you can't smell things and you can't hear things and you can't see things very well, you start to retreat back into your mind. And that can lead to some real serious brain issues because you're not giving the brain the excitement, the stimulation that it needs. If you like stimulation, go to my website, drjoe.com. Under education, we have all my radio shows, my podcasts, lectures that I've done, blogs. Listen to them over and over and over again. Amazing stimulation for the brain. That's a great way to get the brain going. If you're not breathing properly, you may have your stomach pushed up against your diaphragm. And the diaphragm, as you breathe, drops down and you suck air in. And diaphragm moves up and you blow air out. And so that's how it works. Now, if your stomach is pushed up against your diaphragm, you may not be breathing properly. And that can be an issue. And then you need nutrition, oxygen, stimulation, and nutrition. I'm almost out of time, folks. If you have any questions, send them to me through my website, drjoe.com. Any health question. It doesn't have to be about memory loss. But I really want to be your doctor. Search my website. Follow me on social media. Please, we post every single day. I need you to do that. Dr. Joe Esposito. Facebook is the Dr. Joe Esposito. YouTube is the long version. We have the long versions there. Podcast. Please subscribe to my podcast. Subscribe to my podcast and my YouTube channel. Do that for me because that's going to help build my following, and that gets us work higher up in the ranks. So the podcast is Dr. Joe for the Health of It. Dr. Joe for the Health of It. We do at least 2 podcasts a week, sometimes more. But everything we do is stored on the website, drjoe.com. Make an appointment to come see us. Folks, thanks for tuning in. I really appreciate it, and we'll catch you next time. All right. For our pop-up show, we have listeners. I'm glad. I didn't know if we'd have anybody tuning in today because we kind of did it at a weird time here. What you got for me?
A follow-up question regarding the pain in my shoulder. I am scheduled for vacation in 3 weeks. Is there a quicker alternative to relieve the pain before the trip?
No. Got to get to the cause of it. Just so you know, we don't drag things out. It's not like we have a secret. We're going to do it on the 6th visit or something like that. No. There you come in. Exam, x-rays, start the treatment, do some acoustic wave therapy on it. Let's do a nutrition evaluation. Get you on an anti-inflammatory diet. Got to do everything we can as quickly as possible. I promise you, I don't drag things out. We want to get you well and out as quickly as we can. So, what else?
I have mercury poisoning, and that has affected me some. Also, stress makes it worse. But being out in nature does seem to be a huge plus.
Oh, absolutely. Yeah, it's called forest bathing. I do it all the time. There's so many places in Atlanta to walk through the forest. There's the Chattahoochee River. There's a boardwalk up in Roswell. You can walk out into the water. There's a lot of things you can do. But mercury toxicity, I hope you're getting that treated. There are certain supplements you can take to help pull out those heavy metals. That's why I like to do a hair analysis on my patient. And like I said, I was selenium deficient and started taking selenium. So, getting out in nature is really important, but you also got to get the diet working. Chlorella is great to bond to heavy metals and get it out of the system. That's in Dr. Joe Super Greens. Cilantro is very good for detoxifying heavy metals from the body. A lot of fruits and vegetables have vitamin C is good too. Glutathione helps clean out the liver. That's very good. Nitric oxide, increase circulation to flush things out. So, yeah, there's a whole protocol we can do for heavy metal toxicity. But getting out in nature is absolutely one of the things you should be doing. Yes. What else?
Is sugar-free syrup a better alternative to regular syrup?
If it has artificial sweetener in it, no, absolutely not. Now, if it's sweetened with stevia, Lohan, xylitol, that's okay. But if it has artificial sweetener in it, I would say turn and run as fast as you possibly humanly can. Of all the things I teach you, the one thing I want you to stop doing right now is artificial sweetener. So the answer is maybe. So what else?
Do you think that there will ever be a cure for ALS?
Well, yes. And again, we got to look at it. What's going on with ALS is amyotrophic lateral sclerosis, horrible disease, Lou Gehrig's disease. It's what he died of. Great disease named after you. But you got to look at what's going on. Well, can we bring down the inflammation in the spine? If it's a peripheral nerve outside the spine, those nerves can regenerate sometimes. Maybe you shorten B12. Maybe you're not methylating your folic acid and your cyanocobalamin. So there's a lot of things we can do. I don't know if it's going to work, but it's certainly worth doing. If you do nothing, it's going to get worse. We know that. So come see us. Let's put together a protocol for you. What else?
Is cantaloupe and melons a good choice?
Of course, cantaloupes are great. Absolutely. High in beta carotene. Beta carotene converts into vitamin A in the liver. Wonderful. I love cantaloupes. I remember as a child we ate a lot of cantaloupes, and so I still love cantaloupe. Yeah. Mm-hmm. What else?
Should carrots be baked or grilled?
Baked would be better because if you grill them, you get those grill marks, and that it may cause things like heterocyclic amines to form. So I would say baked the carrots would be a better choice than grilling them. Yeah. Mm-hmm.
That is all.
Thanks, guys. I appreciate you tolerating my pop-up time here. I know it was a little weird, but please follow me on social media. Any questions, drjoe.com. I hope to see you as patients